Hello and welcome to another session of our book club where we are reading currently Your Body in Balance by Dr. Neal Barnard. And today we're going to cover chapter 6 and 7 actually. Chapter 6 is about menopause. So this is a very popular topic, very common topic. It's a topic that a lot of women um, experience. So on page 88, Dr. Barnard says that menopause is part of life. And some of the symptoms are hot flashes, unpredictable emotions, changes in sexual function, and memory fog. If you have found yourself on a roller coaster of hot flashes and emotional changes, all of this is likely to pass on its own. It may take time, but you will eventually feel much more in control of your life. So he goes on to give some examples. So there is Anne, who was suffering with hot flashes. And it was during the day and during the night, and it was hard to sleep, difficult to sleep. And so it says here on page 89, quotation, "So I picked up a can of soy powder and stirred it into soy milk and drank it in the morning before work. And within a couple of weeks, the hot flashes were much less frequent and less intense. They dropped from several times a day to just a few times a week. If I skipped the soy powder drink for a few days, the hot flashes returned. When I resumed the drink, they disappeared again. That convinced me that this was cause and effect. As long as I had that daily drink, my hot flashes were much more manageable." We will see throughout these chapters how there are other things that will help even more, but you may consider doing what Anne did. Then there's Marie. Marie grew up on a dairy farm in Tennessee, the youngest of two girls. Her health was excellent apart from some joint pains. She was 50 years old when, out of the blue, she had an unusual warm sensation. She realized that, of course, this was menopause. Unfortunately, the hot flashes worsened and eventually became debilitating. Her doctor recommended hormone replacement therapy, HRT. HRT was not just a way to control hot flashes. It promised to delay wrinkles and help women stay younger, or so doctors said at the time. She agreed to try it and found that, indeed, HRT eased her symptoms. But as soon as she quit HRT, hot flashes returned with a vengeance. So 3 years later, she decided to tune up her diet. She eliminated meat, dairy products, and processed foods, and stopped adding oils to foods. She ate a lot more fruits and vegetables, and good things started to happen. After about 3 months, it hit her. I'm not waking up in the middle of the night anymore. I'm not having terrible hot flashes during the day. Her hot flashes were not gone, but they were mild and infrequent. And she says, I may have 1 or 2 a day, and I just feel a degree of 2 warmer, not really hot. At night, I am occasionally warm, but I'm not burning up. My family no longer has to joke about finding me as a heap of ashes. In the bargain, she lost 35 pounds. Long-standing joint pain subsided, and as did sinus problems, and her energy levels skyrocketed. Today, she prefers simple foods. So this is really good here. This is to give you an example of some of the simple foods you can try. Breakfast might start with steamed greens, followed by oatmeal with berries or a banana. Lunch or dinner could be a salad, beans and rice with salsa, or baked sweet potatoes and generous amounts of vegetables. She says, I never thought I liked vegetables before. Now I love roasted squash, roasted Brussels sprouts, and steamed cabbage. I center my meals around vegetables. Dessert is grapes, apples, pears, or other fresh fruit, whatever is in season. This tells you that, I mean, very briefly, really, but it shows you how it is possible to reset your taste buds so that all of that oil and salt and fat and sugar and processed sugar leaves your body, and your taste buds are clean and they can actually taste the wonderful taste of fruits and vegetables and legumes and grains. That is really, I want to highlight that that is really what we do in my 7-day detox and reset program. We reset your taste buds, we detoxify so that you can finally, once and for all, learn how to make several easy meals with a few ingredients only and make them taste so good that you will stick with it. I hope that at some point, even if it's not in this upcoming one and the first days of November, that some other time you will join. I promise you that you will be very pleased. So on page 91, oh, and by the way, yeah, you can find information on my website, lantemas.com. Okay, very good. What is menopause? So I am not going to go into that. That's page 92, 93, 94, and part of 95. You go ahead and read the details of what menopause is, but you all know what it is, right? I mean, nobody has to tell you, but it is good to read more of the actual science and medicine behind it. And then, of course, this was, like Dr. Barnard says at the very beginning of the chapter, menopause is part of life, okay? It's just that in North America, in the recent years, in the last few years, menopause has been made a disease. It has become a diagnosis, partly because of the pharmaceutical industry who want to sell you prescription drugs and other products. But really, menopause has been going on since the beginning of time. It's not a disease, it's a normal part of life. Yes, by eating the rich foods of the Western diet, we have made it worse than it needs to be. But once you take those things that you're eating that are harming you, once you take those out, then everything comes back to normal. So on page 99, he talks about some better choices. He says other hormone brands. Okay, so a woman who is turned off by Premarin will find plenty of other choices. Okay, this other drug is made from the urine of horses. All right, so it just doesn't sound very appealing. It's not bad. Okay, there are better choices if you're looking for better choices. Okay, so other hormone brands are not made from horse urine. On page 99 at the bottom, it says, estrus, estroderm, senestin, ogen, orthoest, and many others are derived from plant sources, yams or soy, for example, and are sculpted into hormones that are a match for your own. So you might want to take a look and do a little research on that. You have page 100 and 101 that talk about that more in detail. And then also in page 101, we have other approaches. There are other medications for menopausal symptoms, including selective serotonin reuptake inhibitors, clonidine, a blood pressure medication that also reduces hot flashes, and others. And there are answers to menopausal symptoms that have nothing to do with drugs. Let's take a look at common problems and how to address them. So let's take hot flashes. Well, you have basically two things that you can try for hot flashes. First of all, is trim away extra weight. You do that very simply. You stop using oil. Oil is one of the easiest things to stop using, easier than stopping salt or flour or sugar. We go in detail on how to make all sorts of delicious meals with no oil. And of course, in my YouTube channel where you're watching this right now, if you scroll down, there are hundreds and hundreds of videos, and many of them are food demos, and none of them use oil. You all know from chapter 1 that fat cells are factories or estrogen factories, and you really don't need to have more than what your body needs. So trimming away the extra fat, the extra weight is important. So besides the oil, what you can do is put aside your dairy products, number one, then put aside also eggs, and then all meat, whether it is beef or pork, chicken or fish, put it aside. Try it, give this a try for 2 periods, for 2 months. This is a very short amount of time for you to really know if this works. I say if, but I mean, I should say so that you can see how it works, because it works. So give it a try. And in most of the studies done, there is one that we can quote here, the study of women's health across the nation, which followed 3,302 women over a 10-year period. So this is a large number of women, and it's not just a 2-month test, okay? The study is 10 years. So thinner women were less likely to be bothered by hot flashes. What else can you do besides trimming away extra weight? It's favoring soy products. That is something that I don't do, because so far in my 10 years of being a whole food plant-based, soy products have not called my attention. Nothing in particular to say that they're bad for you at all. Okay, just it's one of those preferential things. I just have not really liked them that much, but I will start including some from now on after reading this book. The women who had avoided hot flashes tended to eat more soy, but especially fermented soy products such as tempeh and also tofu, for example. Next, the same researchers followed a large group of Japanese women year by year as they went through menopause. It turned out that the women who included the most soy products in their routines were 68. It's almost almost 70% less likely to have hot flashes compared with those having the least soy products. Overall, soy products do seem to help, but do not entirely eliminate hot flashes, though. So don't think, I mean, it might. Don't think that just because you're including more soy products, they will magically disappear. It helps a lot, but they usually don't totally eliminate them. Okay, so there are various herbal treatments that are promoted for hot flashes. Overall, they have a very modest effect. So again, don't expect anything amazing, but you can expect some improvement. And of course, any improvement is worth trying. So he mentions on page 103, red clover. Red clover has shown some benefit, particularly for women with frequent hot flashes, using an 80 milligram dose. Black cohosh has also been tested with mixed results. A recent study using 20 milligram doses showed a reduction of hot flash frequency and severity, with the improvement gradually kicking in over an 8-week period. Okay, you can find these products online and in health food stores. Then on part of page 103 and then 104, 105, it talks about sexual functioning. Again, these are some products and things that you can try for dryness and uncomforting feelings during sexual intercourse. But I will just leave this for you to read because he explains it so well that I don't know what to take out of here. So I would have to sit here and read for you 3 pages, which could be a little monotonous. So please read that. It's very, very helpful. Very good. So that's the chapter on menopause. Now, we move on to part 2 of the book, which is called Hormones, Metabolism, and Mood. And chapter 7 is a short chapter, and it's something that affects men. So it's called Curing Erectile Dysfunction and Saving Your Life. So again, on page 109, 110, 111, 112, it talks about what it is, the effects of the little blue pill, what back pain means. Okay, so on page 112, he talks about low T. What is low T? Which is not likely to happen. But some men imagine that flagging sexual potency is a result of low testosterone. And there are plenty of television commercials that would love for you to take a prescription to the pharmacy counter. Okay. And let's see here. Okay, on page 113, if your blood tests show you're actually low in testosterone, testosterone treatment typically has only a modest effect on libido, erectile function, and sexual satisfaction, and no effect at all on energy or mood. So it is not the cause of erectile dysfunction to have low levels of testosterone. If your blood testosterone test results are in the normal range, it will likely do nothing at all, at least nothing good. Will it hurt you? Hopefully not. A 2018 study linked testosterone treatments to a higher risk of heart attacks and strokes. So do you think it's worth to take testosterone and die of a heart attack or a stroke? Well, I guess it depends. I don't think it is, but this study was done on older men and only in those receiving injections. That's where the higher risk of heart attack and strokes was, as opposed to other forms of testosterone. The effect on prostate cancer risk is uncertain. So Dr. Barnard says in page 113, all in all, low testosterone appear to be the modern day equivalent of iron poor blood, the 1950s era notion that low iron was the cause of fatigue and geritol was the answer. Okay, there are, in fact, lots of reasons for fatigue and low sexual desire. A low iron and low testosterone are far from the most likely causes. If you are considering being tested for low T, be sure your doctor does not have a low J. You know what a low J is, right? Well, that is a doctor with low judgment. You need a doctor with good judgment who will not push pharmaceuticals when they are not needed. One of the reasons for erectile dysfunction, of course, is the narrowing of the arteries, which also causes problems in your eyes, it causes problems in hearing, it causes problems in heart, in the brain, in your legs, because arteries run through the whole body. So if you're plugged up with cholesterol and fat, of course, you will get problems in all of those parts of the body where blood flow is not flowing well. So in 1990, Dr. Barnard says, Dr. Dean Ornish made medical history. Yes, he did. And you can find a couple of interviews with Dr. Ornish here in my YouTube channel. And I did a book club on his new book that came out 2 years ago. What was the study? Why did he make medical history? Because in a carefully conducted research study, he aimed to see if heart disease can be reversed. And the short answer is, yes, it can. And I'm not saying it. These studies that are published in medical journals say so. Also, Dr. Esselstyn, with whom I have several videos here too in my YouTube channel, and I've also done book clubs with him, also wrote a book and showed the proof of how arteries open up and the damage is reversed. So basically, how is that done? Well, that's done by taking out all of the animal products, not some, all meat, no matter from what animal it comes, all eggs, all milk and cheese, and any dairy product, butter, cream cheese, anything that comes from an animal, and also vegetable oils. And you may wonder, what am I going to eat? Well, there are thousands of vegetables and legumes and different grains and fruits and vegetables. And the variety is endless. You just have to learn a few tricks to get this to work for you. So in this study, after a year, the research participants had an angiogram, which is a special X-ray that shows the trickle of blood that gets through the heart. And the results were compared to the same test done when the study began. It turned out that the arteries were reopening so much that a measurable difference was seen in 82% of the patients with no medication and no surgery, just a simple program of lifestyle changes. So What are the steps for reversing heart disease or artery disease? Well, here we have the 4 steps as outlined by Dr. Barnard on page 114. They are a plant-based diet. So plants have effectively no cholesterol at all. And obviously, they have no animal fat. That is key because animal fat is high in saturated fat, which boosts cholesterol levels. Getting animal products off your plate gives your arteries a chance to heal. Give your arteries a chance. They're trying to heal every minute of every day. But if you're constantly injuring them, they will never recover. Give them a chance. Give them a couple of months, maybe even, I don't know, a week or 10 days, you will notice a difference. Number 2, moderate exercise. If you have heart disease currently, let your healthcare provider guide you as to how much exercise is safe. For most people, a 30-minute brisk walk each day, that is a 30 continuous minutes or an hour 3 times per week, is a good place to start. If you're not able to do meaningful exercise due to severe joint problems or other health problems, you will be glad to know that you can still do well, even without exercise. Okay, number 3, stress management. This can assume many forms. Dr. Ornish recommended yoga and meditation, and you'll find your own best method. See what allows you to helpfully tackle the stresses of day-to-day life. And number 4, no smoking. Smoking is rough on arteries, just as it is on your lungs and all the rest of you. Obviously, tobacco is out too. If this sounds challenging, remember, it beats surgery, chest pain, and chronic impotence. Soon you'll come to appreciate how great it feels to be healthy again. Another thing that helps, which we have mentioned now numerous times, is just losing some weight. Losing some weight will also improve sexual function. How do you lose weight? Well, by following a whole food plant-based diet, like Dr. Barnard recommends, Dr. Ornish, Dr. McDougall, Dr. Esselstyn, and many, many hundreds now of doctors. And it is what I recommend, and it is what I show you how to do in simple steps in my 7-day program. So to finish, on page 116, it says exercise helps. But remember, number 1 is following a whole food plant-based diet. Because if you exercise, but you continue with your old way of eating, it's not going to produce the result. Number 1 is changing the food. Okay, and finally, the epilogue. Viagra researchers made another interesting discovery. They found that the drug is less effective when taken with a fatty meal. A greasy dinner can delay the drug's action by about an hour and can reduce its blood concentration by 29%. So to make your Viagra work better, should you have it with a low fat vegan? Okay, so that's a question. So to make your Viagra work better, should you have it with a low fat vegan meal? Well, if all your meals are low fat and vegan, you may not need Viagra at all. See you tomorrow for our next to last session of the book club. We will talk a little about diabetes on chapter 8. And Also, chapter 9, a healthy thyroid. See you then. Bye-bye. Thank you.